I'm an orthopedic technologist. I've been working in the field for about 34 years in orthopedics, working as a certified orthopedic technologist since 1990. I've worked in Children's Hospital, Vancouver General, and St. Paul's. I've retired out of St. Paul's as of last year. I also worked in Winnipeg, which is a few years back. So 34 years takes me back to being basically just coming out of my mom and staying in the hospital and working, if you believe that. But talk about this waterproof materials. There's about two products on the market that are deemed and advertised as a waterproof liner for a synthetic cast, which is a fiberglass cast. There is no way you can have a waterproof cast in a plaster cast. There is no way you can have a waterproof cast in a plaster cast, and I say that twice because I see people grabbing this stuff off the shelf quite frequently, putting it down on the skin thinking that it's ordinary liner, and then putting plaster of Paris over it and telling the people, yeah, you got a waterproof liner in there, go swim. It doesn't work. Plaster of Paris is not waterproof, it falls apart. And it happens quite frequently, to be quite honest with you. And that comes down to training. And one of the problems with being trained with the materials is that you guys are bombarded as an emergency physician with so much training. This is something that is really not top priority, but it needs to be in some extent, because if you send a patient out with a tight cast, they'll be back in a couple hours, or they might not come back until it's too late when they have irreparable damage because of a tight cast. So it's important to know how to put a cast on. There is instances where we've had people end up with incredible bad problems because of tight cast. That being said, pediatrics, do they need to go in a waterproof cast? Hell no, nobody needs to go in a waterproof cast. It's a comfortable thing to have a waterproof cast in order to cleanse and have just have baths and showers in that materials. Do kids need to be in a waterproof cast? It's nice to have a child in a waterproof cast if they're an appropriate patient for a waterproof cast. One of those appropriate patients is something that you're not going to be worried about being displaced if they are not following the rules. You know, kids are so funny that you put them in a cast, and as soon as they don't have that same height, they're off and running in that cast, and it's quite common to see that. With the cast materials, as I said, there's two of them, which is the Delta, and the other one is the 3M Gore is the other name. And that is a solid white strip of material, of Gore-Tex material and plastics involved there, that comes just like an ordinary roll of soft roll, in that you can't really see through it. This material is quite porous. This is what makes the difference between the two materials. This I find, and just through my own experience of dealing with both materials, because I was the one that introduced Gore casting to Children's Hospital, and I was quite adamant that this is the best stuff in the world. And I ended up going to a conference for the CSOT, the Canadian Society of Orthopaedic Technologists, and they brought this out, and I go, well, what the heck is that? It feels funky. It doesn't feel very comfortable. It feels like it's going to be itchy. And that was the first things that you thought about. A, it's plastic, or you can't put that against your skin. B, oh, it feels like it's going to be itchy. Well, it isn't. It's not itchy, and it tends to lay down better than the other materials, as I talked to you about Gore. Gore, you almost need a special course to lay that material down, because it progressively gets tighter as you lay it down. This material has the same stretching properties as an ordinary orthopedic roll, a soft roll. And I did have one kicking around here. So it kind of has the same kind of stretch that you can lay and contour to this arm or leg that you're trying to lay it down on. So therefore it lays down a little bit better. With a product of this as opposed to the other one doesn't offer a liner that goes underneath. There's two different kinds of liners. This is a thick liner that you can double up and use just as your pad. Maybe a little bit over the bony prominence of the styloids at the distal proximal aspect of the cast. Boom, 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 and that's all you really need, because this is enough padding for that. So if you're worried about having too tight or too thick of cast because you're laying down too much materials, there's ways to eliminate that just by practice of laying down your cast materials and or utilizing what's available to you, such as double thick stockinette. Why is the stockinette important? It's the same reasons as if you put it on as plaster of Paris, for comfort's sake. If you put the stockinette on appropriately and don't pull it up and leave it pulled up. You need to pull it back down to redirect the hairs of the arm or the leg so they don't stay standing up in that underneath with the stockinette. And that's what happens when you pull a stockinette. So if you pull it up, always give it a pull back about an inch. It redirects the hairs and tends not to be so itchy. But with the stockinette, after you put your soft roll over top of it and finish off your cast with a fiberglass or a plaster of Paris, whatever you're using, if we're not talking about waterproof material, that stockinette can be enclosed at the distal proximal end of the cast. So when you get probing fingers in there, you tend to glide between the skin and the stockinette as opposed to the orthopedic wrap or soft wrap. Because when you start pushing things in there and you got a tubular telescopic wrap on the arm, you end up pushing the materials down where it causes compression of the materials and causes pressure. And where there's pressure underneath the cast against the skin, we're going to have ulcerations, or we're going to have some troubles with persistently looking for that itch or that problem that you have by sticking things in there. So stockinette is a benefit when you're dealing with just casting in general. It's a benefit when you're dealing with a waterproof material because, again, it does help to lock the soft roll in there or the Delta Dry material in there, and it kind of prohibits kids from trying to pick it out, which if they get a tail, they'll start pulling at it, and you won't have a tail if you get a stockinette incorporating and enclosing that material in. And also it prohibits them from jamming things in there. So when it comes to waterproof materials, the upper extremity has really no problems with drainage. You can go any direction you want and the water's going to come out because water always flows downhill. It's the same with the lower extremity. A lower extremity, most of the time, what happens is it drains down at the back of the heel and puddles at the back of the heel. If you've known anybody and or done any casting for long periods of time, you'll find that that's a macerated area for a lot of times when people wear casts, be it non-waterproof or even sometimes, heaven forbid, the gore cast materials. It does tend to pool and catch stuff. The gore doesn't breathe as well. Again, I'm dealing with the comparison of the two materials because I really am sold on this material, not as working for the company, but as a caregiver to patients. And that's what sold me on this material because it drains so fast. It doesn't catch gravel or other things in there. It tends to flush fairly quickly. It also tends to wick water away from the skin a lot quicker than the Delta or the gore cast material. So again, with that material and a short leg cast, you get drainage just as well. You got to remember the cast is very porous as it is. It's thousands of little holes in that weave bandage wrap, so it does drain really quite easy. This material will drain fairly easy too because you can see through it. The other material, again, as I mentioned, it overlaps in such a way that it is a waterproof, it's a Gore-Tex, it breathes from one side, drains out the other side like this. But once you get too many layers over top of it, it starts to catch and hold water. So one of the problems with pediatrics is kids do not listen at all. They don't. They'll go to the park and they'll drop sand down there because it's someplace to put sand. They'll put gravel in there. I could sit here and tell you 17 years of horror stories I've seen at Children's Hospital, from ends of HB pencils being stuck into the cast with the eraser and the cap being stuck in the cast and migrating into the skin and causing osteomyelitis. That was done, one of those ones was done with a popsicle stick. A kid had a popsicle stick and chewed and broke and played with it and scratched his leg, and he dropped it down here. He was absolutely scared later on as we talked to him to tell his mom that he dropped it down there. So he left it. And you know those kids, once they get feeling a little bit comfortable, nothing stops them. They're still going to play. And that child did play on that cast and wasn't supposed to ambulate on that cast, but did it anyways. And when he came into the cast room, I could smell that cast. Even today, I can still smell it. I went, oh my, somebody wasn't watching this child. And of course, the kid wasn't being watched. It wasn't in a waterproof cast. The kid got the cast repetitively wet. More than likely, the mother bathed the child in the cast, which is common to see them do things like that because they just want to get their babies clean. And we took the cast off, and that, of course, migrated into the skin and hit the malleola. And again, osteomyelitis. That was a bad story because it got worse. It just compounded into a really horrible story, that one. So waterproof casts are not a real necessity for kids. It's a comfort sake. It's will help mom look after your child, put them in a cast, allow them to go and do their beachy thing stuff. So if you go down into the Okanagan, running around in a short leg cast with a protective boot, and you need to have a protective shoe on the end of all cast. You cannot walk on fiberglass. fiberglass will eventually soften up and start to crack. And then you get fiber particles falling into the cast where fiberglass can migrate into the skin and cause troubles. That's true for plaster too, but not as bad because plaster Paris tends to crumble down a little bit more. But if they're up on the beach and having a lot of fun running around on there, it's just a matter of making sure that they get at least a good 1 to 2 minute rinse from the top of the cast down with a fairly powerful hose or a faucet to blow whatever sand that's being collected from swimming in the water. You don't have to just be on the beach to collect sand in your cast. You can be floating on the water because there's particles of sand floating in there, and those can get in there. Putting a waterproof cast on post-operatively, usually what we've done was we put a cast on when they're ready to have one of those waterproof casts when they're ready to have their sutures or staples taken out. And if the wound is intact and in good shape, when we do remove the staples or the sutures, we can give them another 24 hours, 48 hours, apply the waterproof cast, tell them to stay out of water, and then they can start progressively getting it wet, being in showers or going swimming and things like that. Again, it's a matter of gravity working for you, and it just drains out through the bottom of the cast. And also just some ordinary basic cast tips. You know, they shouldn't step on the bottom of a wet cast. It doesn't matter if it's fiberglass. It should dry up a little bit, because what happens is if it's wet, there's a little bit more give to it. There's a little bit more sponge to it. So if it drains out that extra 5 minutes, 10 minutes before they actually start walking on it, it'll stay strong. To eliminate that problem of the cast falling apart is just a matter of making sure that you put a strip under the sole of the foot, so when they ambulate or walking on it, it doesn't get that soft any longer. Any questions dealing with fiberglass or waterproof materials? Have any of you applied the material before? Have you applied the Gore cast material before? Were you happy with that material?
Yeah, I'll try.
Can I ask you, can I ask you what your problems were with it? Did I hit you on the nail there?
Yeah, you wrap it, it gets more.
It gets progressively tighter if you're not used to the materials, and you end up with a lot of wrinkles and a lot of excess materials and folds and that. Usually those folds really don't cause any troubles. You'll have folds with this material too. It depends on how you aim your cast material as you go up this conical elliptical object. If you go on an oblique angle as you run it up to the elbow, you'll find that it lays down a little bit easier than just a telescopic wrap.
So this is two types. So there's a stockinette. It's also quick dry.
The stockinette is exactly made out of the same material.
So you can't use regular stockinette.
You can't use regular stockinette. Okay. Well, I stand there. Can you get a synthetic stockinette wet, and will it dry? Yes.
I'd imagine they do.
They do, and I would be lying to you if I didn't tell you that. But I would also be putting you into a position of jeopardy if I told you to use stockinette in combined with waterproof material, because they just don't jive. This is the work with water material and synthetic cast materials. It doesn't matter if it's BSN or if it's 3M or if it's Delta Cast or Johnson & Johnson. It doesn't matter what kind of cast material. They're all about the same materials. But the liners do make a difference, and there's only 2 liners out there. There was another material out there that was there. I'm sorry, I'm tying up your time. You just raise your hand when you're done hearing me talk. There was another material out there that was called Wet and Dry, which was done by 3M. And it was a soft roll. It looked exactly the same as it, but they call it Wet and Dry, which they promoted as a cast material that you can get wet. You cannot get that stuff wet. That's the stuff that causes all the troubles and macerations. They actually pulled it off the market for a while because they had so many complaints of people using it as a cheap alternative to a waterproof cast that didn't work and jeopardized the skin of your patient, especially if they have any problems with their skin. Would anybody like to see one of these applied? Yeah, there we go. We love a volunteer in the group.
Priya or PEDS people, can you talk to the cost and who's going to bear that? Because I know other places. Yeah.
I can relate on that because I set up the costing factors at St. Paul's Hospital and at Children's Hospital. Again, I introduced the material at Children's Hospital, be it the Gore-Tex. I did not introduce this material at Children's Hospital because I was already on the move at the St. Paul's. And this is what I brought in the St. Paul's. You'll find that a lot of orthopedic surgeons are very apprehensive, and even emergency physicians are apprehensive about throwing their patients in cast materials that allow them to get wet. We all know the possibilities that are there, but you have to judge your patient appropriately if they're a good candidate to be in a waterproof cast. You know, if they're not a good candidate, they can't follow the rules. If you say, well, you know, I'll put this waterproof cast on, but you can't get it wet for another week because we really don't want you ambulating or doing anything crazy with this. Just take it easy. You just have to know how to judge your patients. Kids, usually what I do is I talk to the parents and the kids in the same room when I was there, and I had a little spiel that went, your mom's right, always right, never wrong, 100% of the time she's right without question. And I need the child to acknowledge that, because we've all been sitting in the room, we all been talking about the rules of wearing a cast, and they know that I'm the one who's given all the rules, but I've just passed the authority on to the child's mom or dad and let them deal with the cast rules too.
So just to answer your question, Scott, in that the inpatient cost for us is nothing. We've gone to the Small Miracles Fund for funding for this product to be brought in, because we realized, like, our population that we're serving, really that's an added cost, and we didn't want to have to charge, so it falls into their ballpark of amount. So that's where the funding for this is.
How many years ago?
Right now it's covered for the first year, but it's under that, it's within their guidelines that they said just to reapply.
Because otherwise, I think elsewhere it's like $25.
It's at Children's they charge $10 a roll, so that's the average cost depending on the size of the cast then, so how much you would use. So I've already spoken to the educator at Children's. They know that we've received the grant and the funding, and they said kudos to you, go for it.
Yes,
so
you're
won't be
lucky to get
charging.
funding, to be honest with you, because
Yeah.
that was our biggest problem too, is that we had to charge patients. We're talking about a population that they're new families. They're not got a lot of money going on. We're starting off a new family, trying to pay for the car payment and the mortgage and that. They're just not there.
Yeah.
So when you offer these products and the kids know about it and make a big fuss of it in emergency, that's what they want. It was really hard for the parents to say no sometimes, and it was really difficult to put them in that position. Most of the time I just gave it to them anyways. I didn't care. Honestly, because we could write it off for what we were charging for the materials, which was double the amount of what we charge, of what we were paying for the materials, is what we were charging to put a cast on somebody. I could pass out 1 or 2 casts with no troubles at all per day to the people that I really thought, you know, you can't pay it, you can't pay it. It was a horrible position to be the judge of that, but
Yeah.
that's how it is. You know?
All right, I think we're running short on time.
Yeah.
So, I'm going to take this and I'm going to double it up for her. Just going to make a little hole for the thumb. Now, if she's one bone involved, like the radius or the ulna, they usually can assist you in this fashion. But if it's 2 bones, you usually need somebody else to help you, okay? Tell me if I got you. Where are you? Oh, that hurts. Stop. Great. So, again, you can double it up like I just did on the hand, or you can pre-double it before you slip it on. I just wanted to make sure that the soft one. So really, she has got enough padding on her right now to do the job. That's just not big enough. Just bring that down just a little bit. What's it feeling? Is it itchy? Yeah. Shouldn't be. I always need to anchor somewhere, so I'll anchor over the carpals, and I'll come distally. As I mentioned to Amy, you guys don't have 1-inch cast material. You should have 1-inch cast material. So this is the way of wrapping it on if I had a single layer, just like ordinary cast, and if I was just going to protect the bony prominent areas over the carpals and the styloids, a little at the distal aspect of the cast, just for the lip. And just right through here just to protect a little bit in here. I'm going to run that up the thumb and on the back. There. So I've got minimal padding. Usually it's about a half a roll with this and with your stockinette. So this is a method of saving money, to be honest with you.
You don't even do the middle area?
You don't need to. You really don't. You could do the same technique using stockinette,
Right.
with soft roll, but you don't look like you're a purple kind of girl. Always got a tag hanging out. Put it in the water about 45 degrees, count to about 4 seconds, bring it out. Squeeze the distal poles evenly like this. If you take the whole unit and stick it in the water and bring it out and squeeze it like this, what happens is by the time you get to the center of the core of the cast material, it's already starting to solidify and set up. It will sit up because of the compression that you put in there. It's exothermic reaction, so it works under pressure. Also works under the temperature of the water. With cool water, I got about a 3-minute working window. I could sit here for another 2 more minutes and then come back and grab that roll and put it on. But that 3-minute working window allows you to put extra materials on. So if you're going above knee or if you're putting a short leg cast on, this allows you to uniformly include them all into one roll. So again, we're just going to lock on here, position, come back down. I'm hearing an echo. And I'm just going to run that up at an oblique angle as I run it up, 2/3 overlap. And I'm going to come close, looking for about 2 fingers from the antecubital fossa, aim for the electron, come up, bring this back down, pull it over, and I'm just going to be a little shy here. So I'm going to run down here quickly. So there's 2 creases on your palm. There's a distal palmar crease and there's a proximal palmar crease. So the distal palmar crease is usually for a short arm cast, and the proximal palmar crease, if you look at your palm, is usually for a short thumb spica. It gives you a little bit more movement. So I can come down and do a little mold and just hold it for about a minute, and that'll do the trick. Now I'm putting it's laid down fairly snug. I'm putting a little bit more pressure over top of it. We have very little padding on here, but I can walk away and feel very comfortable with this. One of the reasons is because I've done this for a long time, but also using the same technique over and over and over again makes sure that I don't end up having troubles with the cast material. Biting up against the skin. That's a nice cast. I think I'll just leave it. I haven't put a cast on for about 10 months now. I mean, fishing. There we go. And 1 roll. Usually 1 roll does the trick. For most short arm cast for kids, 1 roll for sure usually does the trick. For more short arm cast, 1 2-inch roll usually does for most females or people of her stature, which are small. And then when you start getting into me, you start looking at different sizes. A quick and easy way, again, to know what size of material to use, just measure the metacarpals. So if it fits in the metacarpals, that's a good size to start with. You don't want to start off with a 4-inch if it's overlapping, because you're going to end up with excessive materials. So it's a lot of quick, easy things to do with casting. Again, any questions?
I think Priya would definitely want sparkles.
You know what? I forgot to grab them. Darlene was bothering me about that. I'm a terrible peds nurse.
Well, years ago we had the Vancouver Canucks produce stickers, casting tape. So we had casting tape with the Vancouver Canucks logo on it. We also had casting tape with what football team it was. It wasn't Vancouver. It wasn't BC Lions. It was another football team. So by approaching the Vancouver Canucks and saying, I can buy boxes of casting material with your logo on it if you can sponsor it, and we'll give it to the kids at the hospital for free. And that's what we've done. We have 500 rolls, and we passed out all free cast because that was no charge to us. Passed that same kind of thing on to the kids.
When it's planes, Calgary planes.
Pardon me?
Nobody wants Calgary planes.
And can I just clarify, are we taking these leaflets downstairs to give it to patients?
Well, to clarify about the leaflets, I just got a new picture, a pediatric picture approved for the front. I think you can all agree. Oh, come on.
I know.
So we're gonna be. I just got
We got a man
the new
doing it.
image today, and so we'll be ordering them with the new pictures. So we don't have the brochures yet.
Okay.
Okay.
Oh,
Great. And we're keeping this and this.
We're
and this.
we're keeping that in stock right now.
Yeah.
We have a few boxes to start with, but we have more on the way.
Is that going to make a mess up here? Sorry.
no, not over top.
Okay. I just, because we cut it off downstairs for you.
I could do that downstairs wherever you want.
I'll do it after the meeting. You've got to go.
You gonna do it yourself, son? Fine.
Get someone downstairs to do it.